This is Sam, a 46-year-old construction worker and father. Sam's main priority has always been his daughter, Lily, and he always seems to put himself and his health on the back burner. Lately, he has been feeling quite dehydrated, has frequent headaches, and feels that he is peeing far too often. He goes to the local health clinic for a checkup. The community health nurse takes a blood glucose reading and fills out a request to get his blood work done. He returns to the clinic next week, and he is told that he has type 2 diabetes.
This spurs a discussion of healthy eating and exercise, and Sam questions the availability of resources in the community to maintain its members' health. Upon reflection, the community health nurse comes to the realization that this is a big problem in their community, and that something should be done about it. As members of the community, the patient and the community health nurse decide to put a team together to solve this problem. As a patient and community member, Sam can provide a voice for the other members of the town who might want to avail of this healthy living program. He can provide suggestions for what types of activities and resources might be of interest in this community, and ensure that the resources provided respect the culture of the community.
This is Sharon. She is Sam's community health nurse. In this situation, she was Sam's first point of contact with the healthcare system. By identifying Sam's needs as well as the community's needs, she is able to guide him to what resources are available in the community and what is not currently available. She can then partner with Sam and advocate for his needs. Next, Sharon can collaborate with other health professionals to form a team that addresses the identified health concern of diabetes. They feel the first step to starting this program is reaching out to a social worker.
This is Kathleen. She is a social worker. She has done research in the community and determined that a large percent of the population is obese. She has determined that obesity among visible minorities has had a 10% increase between 2009 and 2016. This has led to an increase in type 2 diabetes throughout the population, increasing the need for more community programming. She can work with an interdisciplinary team to ensure that the culture of the community is considered throughout the process and that the social concerns of the community members are used to create social programs to address the issues within the community. Now that the core team has been formed, the team reaches out to other healthcare professionals to seek their input and make use of their individual skills.
This is Martha. She is a kinesiologist. As a kinesiologist, she can form a variety of movement-based lifestyle guides suited to different age groups and cultures in the community. This guide will help people to gain strength, mobility, and balance, which contributes to their overall physical health. This will be a great way to get people moving and active without intimidating beginners with a difficult workout plan. As well as providing simple at-home movement programs, they can implement a variety of training classes at the community center. Many beginners find it easier to maintain the regimen if they have someone making the journey with them. Not to mention, it would boost community morale, as well as providing people with the opportunity to meet different people in their community that share the same goal. By implementing this program, the team is able to note exactly who is participating and if it is effective.
This is Darwin. He is a nutritionist. He can form a food plan with information and recipes tailored around the food most accessible in the community that caters to a variety of cultures. This will make it easier for people to cook more nutritious meals without having to break the bank. The team can include this food plan with the movement guide and send it out as a health and well-being package to all members of the community.
This is Brian. He is a family physician. He can suggest that the team integrate community monitoring and checkups into the program. The community health nurse can refer any patients that are deemed to be at high risk for diabetes or other obesity-related health concerns so that they could receive any necessary diagnosis and further care.
This is Lisa. She is a pharmacist. She can provide the team with information on treatment options and their effectiveness. These treatment options will include both medications as well as therapeutic alternatives. She will also contribute in a patient-focused way, directly educating the population about the use of drugs and devices related to diabetes, obesity, and other comorbidities.
Using the advice from the interprofessional team, Kathleen was able to apply for government funding to help implement the programming needed to create change within the community. Sam and Sharon reconnect to discuss the program they have worked on. They both agreed this was exactly what the community was lacking. This program was a step in the right direction.